Hello, Jim. My name is Hannah, and I would like to talk to you about a few labs that were ordered. It looks like your provider ordered ALT, ALP, and direct bilirubin. These labs generally focus on liver function. The range that we are looking for on that ALT is about 10 to 40. The purpose of this specific lab is to check for any acute hepatic disease. Some symptoms of an increased value could be yellowing of the skin or the whites of the eyes, loss of appetite, or dark colored urine. Usually a lower level isn't much of an issue, but it can appear as fatigue, weakness, and there are some subtle signs of nutritional deficiencies. Something that can affect an increased level would be medications that are known to cause hepatic injuries or even opioid usage. Tylenol and aspirin therapy or high levels of Tylenol and aspirin usage can cause high values for that ALT. The next lab on the list is the ALP, and we like to see that one around 50 to 120 units. This lab is used to detect any bone disease. It can be used to detect tumors and is generally used for supplemental information with other labs. Symptoms of a high level would include yellowing of the skin or the whites of the eyes, bone pain or itchy skin. Symptoms of low levels can appear as numbness and tingling. There are things that can cause high levels or false highs, such as recent healing of a long bone. So if you've recently broken your arms or your legs, that can reflect on this lab. There are age and gender factors, and consuming large fatty meals commonly can also raise that. So if we eat fast food commonly, that is known to raise this lab value. This lab will need to be sent within 4 hours because it can cause a low value if it gets to the lab a little bit later, but that is my issue, not yours. The last lab ordered is a bilirubin check. That should be in a range of 0.1 to 1.0. This is to evaluate the function of the liver and can be used to diagnose bile duct blockages. Symptoms of high value would be things like yellowing of that skin or the eyes, dark urine again, or even pale stools, and it's like a very light brown or almost white. It is usually very rare to have low level under that 0.1. We use this to check for anemias or, like I said, that blocked bile duct. A fun thing to know about bilirubin is that UV therapy can help lower it. So this vial that contains the blood sample actually needs to be out of any sunlight to prevent it from lowering the actual value. Again, that is not your concern. I just think it's a little fun fact about bilirubin. For these labs, the ALP and bilirubin do require fasting, so please no food or liquid for 8 hours before the labs are drawn. These will all be blood draws, but generally can be used off of the same needle, so only one poke. And once they're drawn, you can go back to normal food and medication routines. Do you have any questions?